It's an interesting thing when you are an acute care practitioner, as I am, working in the stroke space, because you are totally consumed about rapid early treatment, first and foremost, right after you've established diagnosis. And then secondly, getting at mechanism, what caused the stroke, and making sure that that's either treated outright with things like carotid endarterectomy or prophylaxed against, right, with things like anticoagulation for atrial fib. We oftentimes forget, though, what that experience is like when the patient leaves the hospital. And it's really very eye-opening. I think one of the best things that we could do is find a way for acute care practitioners like myself to have kind of time in this seamless outpatient environment so that they don't lose track of those patients that they're seeing. The limitation there is that oftentimes when you're acute care like me, while it's a wonderful thing to see those patients, you're less interested in that space. It's not where you thrive as a practitioner, running down to the emergency department, for example. And I tend to be a very well caffeinated person that wants to be in the middle of the fire, stomping it out. But I do have to say that when I have followed patients into outpatient clinic, it's really been an eye-opening experience, just understanding what it's like to be in their shoes, and to now reintegrate back into society to try to, reestablish some new normal. And we really are poorly prepared to understand that unless we place ourselves in that position. So finding ways to make that happen, I think, is really important. I'll also say, as the editor-in-chief of Stroke Clinician, again, stroke navigation is not my area of expertise. And I was so struck by every piece that was submitted to our spring 2024 issue, starting with the guest editorial by Jennifer Edwards, really providing that history of where this all came from, and really culminating in the Can Do paper, which really provided the richest wealth of data about the stroke navigation process. It's a huge undertaking to take on, and I'm awfully glad that these positions are emerging, because people like me, we don't have that expertise to work in that space, and there's clearly a tremendous patient need.